We're good to go. Okay, thank you everyone for being so patient. We are ready to get started here, and thank you everyone for coming. We are beyond excited to have our presenter, Pat Smith, with us, who is a graduate of Monmouth University, and for 25 years she has served as president of an all-volunteer, nationally run nonprofit Lyme Disease Association. She's a member of Columbia's University Lyme and Tick-Borne Disease Research Center and a member of the Food and Drug Administration, PESP, excuse me, to promote tick exposure. And she serves on many panels for Limex, the public-private partnership between the Cohen Foundation. She served as a public member for the Hhs Tick-Borne Disease Working Group in Washington, D.C., where she has co-authored several reports to Congress in 2018 and 2020. She's been appointed in 2016 to a member of the U.S. Army Medical Research and Material Research Program, a member of the Congressionally Directed Medical Research Program Programmatic Panel, where she has served 4 years. And she's been a testifier in front of Congress in support of Lyme disease and further advocacy. So on behalf of the Winnebago Public Health Nursing Department and my staff, Jane Langemeyer here, welcome, and I will turn the presentation over to Ms. Smith.
Thank you very much, and I appreciate you setting something up so everyone can learn about Lyme and tick-borne diseases. A little bit quickly on the association, about 95% of our funding goes to our programs. We've awarded 123 research grants, 60 journal publications resulted from that. We've also provided 159 educational grants. We have a Lyme Aid for Kids fund for medical help for kids trying to get diagnosed and treated. And we work with Columbia University. We presented 21 continuing medical education conferences for physicians, and we belong to the combined federal campaign for the federal workplace giving, and we partner with about 40 different U.S. Lyme organizations under the LDA net umbrella, and also with the Environmental Protection Agency PESP program, which is trying to get rid of ticks, a goal I think we all have. I was twice invited to the CDC vector-borne diseases branch in Fort Collins, and I testified before 2 different U.S. House committees on Lyme in DC. Now, in 2007, our organization partnered with a Connecticut partner, and we opened the first endowed research center in the world for Lyme and tick-borne diseases at Columbia, and they've done a tremendous amount of work and still are on neurologic research into Lyme. Now, Lyme disease is in more than 80 countries worldwide. And if you look at this graphic, these are maps that we produce each year that when the CDC puts out their reported case numbers. So the first one shows you in 1990, there were 7,900 approximate reported Lyme cases. And in 2019, there were almost 3,500 reported cases. And from 1990 through 2019, there were over 716,000 reported cases. But again, these were all underreported significantly. And the CDC website now says that there are about 476,000 people who may get Lyme disease each year in the United States. Now, if you do use our maps, you're welcome to. You can click on your state. For example, here, this is Nebraska clicked on, and you will see your reported cases from 1990 through 2019, which is the last reported cases right now from out of CDC. Now, the association also has taken CDC numbers from 2001 to 2017 to see by age what is the proportion of people getting Lyme. So adults 20 to 90 plus years, 71%. Children 0 to 19 years, 29%. So children are at high risk. Now, the born and unborn are affected by Lyme, meaning pregnant women can transmit Lyme to the fetus through the placenta, transplacental transmission. And this can cause death of the fetus and perhaps in some cases birth defects. Now, Fair Health, which is a national nonprofit that has a database of more than 36 billion privately billed healthcare claims records for more than 70 contributors nationwide. They do various studies on diseases and linking claim form. A claim line is an individual service or procedure listed on an insurance claim. So what they found from 2016 to 2021, in rural areas, Lyme increased 60%. In urban areas, it increased 19%. Now, what does that mean to you? Well, in Nebraska, according to the Daily Mail, which used that data from Fair Health and also postings on Johns Hopkins Tick dashboard, Nebraska ranks number 5 in states with the largest increase in Lyme disease claim forms from 2016 to 2021, 60.6%. Now, Nebraska puts out their Department of Health and Human Services some great alerts periodically on tick-borne diseases. And many of you, I'm sure, know about these. 2016, they showed that well-characterized tick-borne illnesses endemic to Nebraska, Rocky Mountain spotted fever, ehrlichiosis, and tularemia. Now, the alert for 2020, which relates to today's program, the key message for Nebraska clinicians, Lyme disease, and they indicate that the established tick populations that were just identified on the deer ticks, this fact makes it possible for Lyme disease caused by Borrelia burgdorferi to be acquired in eastern Nebraska. However, even with these established populations, Nebraska is presently considered a low prevalence state for Lyme disease. At this time, local human health risk is unknown, but clearly of increased concern. Now, reportable tick-borne diseases in Alaska, babesiosis or lichiosis, Lyme disease, Q fever, Rocky Mountain spotted fever, tick-borne encephalitis, and tularemia. So, getting into the diseases, first quickly about our pets. Dogs act as sentinels of Lyme disease, and they're often diagnosed with Lyme before people. They're 50% more likely to develop the disease because they tend to roll in leaves, they run unchecked into tick habitats, and they can bring unattached ticks into the home. And they also can get ehrlichiosis and anaplasmosis, dogs. And there is a Lyme vaccine for dogs, and some vets are favorable to it, others are not. Now, cats can get Lyme, but they get it a lot less. And they can also get Ehrlichia and Anaplasma and bring in the unattached ticks. And there are a number of studies showing that there's a great increase in risk with people who have dogs and cats as pets for getting Lyme and other tick-borne diseases. Now, what about canine tick-borne disease in Nebraska? Well, the Companion Animal Parasite Council, which is an independent nonprofit of professionals, forecast for 2022 high risks of Lyme in all portions of Northeast, Upper Midwest, Western states of Wisconsin, Minnesota, and Upper Peninsula of Michigan, and a higher than normal risk continues in North Dakota, Northeastern South Dakota, Iowa, Illinois, and Eastern Kentucky. Now, they also showed on their maps they do testing for with dogs to see what tick-borne diseases they get and in what proportion. So in 2021 for Nebraska, 1 out of 500 dogs tested were positive for Lyme. For Anaplasma, 1 out of 100. For Ehrlichia, 1 out of 100. Now, the data that they use on their website, they indicate it only represents about less than 30% of the activity in your geographic region. So what are the significant players in Lyme disease? Well, we have the reservoir hosts, which harbor the disease. And in the east, the white-footed mouse, the vole, the chipmunk, the eastern gray squirrel, the shrew, other small mammals, and some birds, including the robin. Now, looking online, you do have all of those animals, it appears, in Nebraska, but I'm not clear. I didn't see anything clear to know whether they all are reservoir hosts there, but there's probably a good possibility that they are. So what role does the deer play? The deer actually is what I call transport and a meal, because the female deer chick often feeds last on the deer, and then it mates there and falls off. And so they don't generally get the disease, but they carry it, the ticks, all over the place. So the vectors, of course, are the ticks, and they transmit the disease. So how do they get on us? Well, the hard-bodied ticks, generally like the deer and American dog tick, they climb small plants and grass, and then questing, animals brush against the grass and the tick latches on. And they're called passive feeders because they're waiting around for their prey to come by. Now, the lone star tick, on the other hand, is very dangerous because it will actually, in quotes, run after you, and it's an active feeder. Now, if you have contact with leaves, ground cover, the ticks will climb up on you. And of course, pets can carry the unattached ticks to you. Now, the soft-bodied ticks, in this case, Ornithodorus ticks, hide in animal burrows, and they're found in old cabins. So a lot of times hunters and fishermen who go into these cabins will get these ticks, and they'll get diseases, which I will talk about in a few minutes. So how does a tick feed? This is really important. It secretes something to numb you. Then it cuts you open with chelicera, which you can see on that diagram. And it sticks the hollow straw-like barbed hypostome in you, something like the barbs that you might see on a fishing lure. And it then secretes a glue-like substance into you to cement itself to you. And then it sucks your blood. Sometimes while it's sucking blood, it secretes blood thinners and immune regulators into you. And during the feeding, any organism in that tick can flow inside you. So here we come to proper tick removal. This is very important, folks. Don't put anything on the tick. Don't burn it. Don't put a lighted match on it. Don't touch the tick with your fingers. Don't squeeze the tick. Do use pointed tweezers close to the skin on the head of the tick, or you can use a special tick removal tool. Pull it straight out. Do not twist or squeeze the tick, because it can inject anything it has into you, and that greatly increases your risk of infection. Then clean the skin area after with antiseptic, and you can save the tick for there's testing labs or for your physician. And we do have examples of those labs and identification places on our website. And call your physician for advice. And if you want to permanently dispose of the tick, stick the tick in tape. That's the best way. Duct tape happens to be my favorite tape for everything. So I use it for ticks also. Tick attachment time. So what we can safely say, longer a tick attachment, the greater the risk of infection. So why are days of attachment used as necessary for transmission when you look it up, and etc.? Generally speaking, the Lyme bacteria is found in the midgut of the tick. And there's some research that says it takes 24 to 48 hours to migrate out to the salivary glands of the tick. So this is why some say 24 to 48 hours tick attachment is necessary. Well, research also shows that is not always true. Sometimes the bacteria is already present, systemic and in the salivary glands at the time of attachment. And that can occur because maybe there's a improper feeding and the tick falls off before it's done and the bacteria is already moved, or they may be other reasons. So other tick-borne diseases can be transmitted in very short time periods. For example, Powassan virus, which we will talk about. Now this is deer ticks and poppy seeds, and it shows you the nymph deer ticks in relationship to the size of the poppy seeds. The poppy seeds are the white in the middle, and this is all, of course, under the microscope. Now you can see that those ticks are the size of, or maybe even a tidge smaller than the poppy seeds. And that is why it's often said poppy seed size nymph deer ticks produce the most disease. Now, this is the stages of the deer tick, and you can see the eggs, that egg mass. They lay thousands of eggs at a time. Then the larva, that's the transparent one in the middle. And usually with the deer tick, they are born uninfected. They don't contain the Lyme disease. When they get to the nymph stage or the adult stage, they might bite an animal, and then they might get infected. Now, this is a deer tick laying eggs called ovipositing. And this is showing you the size difference between the American dog tick on the end of the paper clip and the three of the deer tick inside the paper clip. Now, this is a fed female deer tick. You can see it on the right, the red one, that's unfed. And on the left, the female deer tick is fed. And that's all in relationship to the size of a safety pin. So you can see how big a fed deer tick might get. Now, it transmits Borrelia burgdorferi and Borrelia mayonii, both of which cause Lyme. Borrelia miyamotoi, which is Lyme-like and also relapsing fever-like disease. Anaplasmosis, babesiosis, Bartonellosis, or Lichiosis, Powassan virus, and it can also transmit tick paralysis toxin. And if you get that, the only cure is to have the tick removed. And I'll talk more about that later. Now, the Lone Star tick, which of course you do have there, Amblyomma americanum, it transmits star eye, also known as master's disease, tularemia, heartland virus, tick paralysis, Q fever or lichiosis, Bourbon virus, and Rocky Mountain spotted fever. Now, it also can cause alpha-gal meat allergy, and I'll be talking about all of these. Now, the Lone Star tick can carry the organism, but there's still discussion by the government if the Lone Star tick can actually transmit Rocky Mountain spotted fever. There is one documented case report, but the government's still not willing to commit to that, that it's possible. So the Lone Star tick, again, it has two new viral diseases, Heartland virus, which has no test and no treatment except supportive therapy. You can see the states there where Heartland has been found. And as of January of 2021, there were 40 plus reported cases. Now the Bourbon virus is another new one. Now that was named after a county in Kansas. Now that when you get that, if you are looking for that virus, you can only get testing done at the CDC. They have the only test. Supportive therapy only. There's no other treatment. Now, as of 2017, there were 50 reported cases in Midwestern and Southern states, and there are a number of deaths reported from it. Kansas, Missouri, and Oklahoma are some of the states where it has now been found. Now, alpha-gal, that again is the meat allergy that you can get from a Lone Star tick, and we'll talk about that again in a little while. Now, the American dog tick, which you do have, transmits Rocky Mountain spotted fever, tularemia, and tick paralysis. And according to CDC, paralysis is thought to be caused by a toxin, saliva of the tick, and people who get the paralysis can experience weakness or paralysis that gradually moves up the body. These symptoms can sometimes resemble other neurologic conditions. Guillain-Barré, botulism are two examples. Patients typically regain movement within 24 hours of removing the tick. Now, the American dog tick, which you also have, the adult female and male that are over in the picture, and along with the female laying the eggs, they can lay 4,000 to 6,000 eggs. Now, these larvae, unlike the ones from the deer tick, are sometimes born out of the egg infected with Rocky Mountain spotted fever. So that's very dangerous because those are extremely small. Now, the Gulf Coast tick you don't have yet to our knowledge. However, it's moving northward and has been. Amblyomma maculatum. It transmits rickettsia, Parkeri rickettsiosis. The signs and symptoms, fever, headache, muscle aches, rash, and there are diagnostics tests, DNA, PCR, skin biopsy, IFA. Now, there are two ticks in the far west, the western black-legged tick, Ixodes pacificus, that transmits Lyme disease, myomotoi, Anaplasma, Ehrlichia, Babesia, rickettsia, and Powassan virus. And the Pacific Coast tick transmits Rocky Mountain spotted fever, tularemia, and Pacific Coast tick fever, which is transmitted, it's called, 364D rickettsiosis, and also known as Rickettsia philippii. I think they haven't decided on what to permanently call it. Probably you haven't seen those ticks yet, and maybe you never will. Rocky Mountain wood tick, Dermacenter andersoni, as you can see by the map, it is in a portion of your state, and some of these CDC maps are a bit behind also, so I don't know if it's spread any further. I couldn't find that out. Rocky Mountain spotted fever, Colorado tick fever, tick paralysis, Q fever, and tularemia are spread by the Rocky Mountain wood tick. Now, the brown dog tick, Hemophysalis Longecornis, transmits Rocky Mountain spotted fever, and it can transmit it to humans. Up until a decade ago, the government told us, don't worry about it. We never even talked about the dog tick because they said it doesn't really bite humans. It doesn't transmit diseases to humans. Well, guess what, folks? They found out that that is not true. During 2010, 1,682 cases of Rocky Mountain spotted fever were reported in the US. Arizona reported 41 cases during this time period, all associated with tribal lands and transmission from the brown dog tick. So even though it mainly may bite dog ticks, it apparently bites humans quite a bit. It also can infest homes. The other ticks we talked about really can infest your home. They get dehydrated and so on. And it can infest dog kennels. It can live its entire life in your house. And of course, you can see that it's totally across the continental United States. Now, this tick you may never have heard about. the Longhorned Tick. And it was discovered and identified in New Jersey in 2017. And it was found on a sheep tick, on a sheep, which had no travel history. And it was totally tick infested. So they treated it with permethrin. They wanted to wait and see if the ticks died over the winter. And they also found large infestations all over the property. Well, those ticks unfortunately wintered over, which is not a good sign. So they were identified as the Hemophysalis Longecornis, and apparently they're an invasive species from Asia. And invasive populations like this are almost always exclusively parthenogenetic, meaning they can reproduce without the use of a male. And since 2017, ticks have now been confirmed in 17 states. And you can see that some of those states are in the South and in the Midwest. The longhorn tick has not yet been shown to transmit diseases in our country to people. However, it has been killing cows. It has in North Carolina, there was a case where 5 were killed. They found 1,000+ ticks on each cow. So the cause of death was acute anemia. The cows were drained of blood from ticks. They died of exsanguination. So to update the pathogens, the Bourbon virus has now been detected in Hemophysalis Longecornis in Virginia, and 1 tick tested positive in a PA study for Borrelia burgdorferi. Again, there's been no cases yet reported that we know about of humans, and it does not require the male to fertilize eggs, which is why these populations can readily establish. So what are the medically important ticks in Nebraska? According to the University of Nebraska, American dog tick, Lone Star tick, Rocky Mountain wood tick, and the black-legged tick. Now, this I thought would be of interest to you. This is a study that the LDA provided grant funds for to South Dakota, and in 2019 collected and identified 266 ticks and tested them for Borrelia burgdorferi by PCR. And what they found is they found deer ticks in 5 different locations, and that confirmed previous reports of established populations in that state. And they found 2 scapularis from 2 different sites had Borrelia burgdorferi. And one of those has now been identified as the southwesternmost detection in the entire Midwestern US of Borrelia burgdorferi infected deer ticks. So now getting into the diseases, first is the Lyme rash. Not everyone gets one, and this can look different than the classic bullseye rash. It can be on other places on your body other than the bite site, usually with disseminated disease. Now, this is a chart showing typical and atypical images of the rash, erythema migrans, and this is from Columbia University. The LDA provided grant funding for this poster. It can be downloaded, printed, or shared on the website for whomever. Now, Lyme disease that this means Lyme disease caused by Borrelia burgdorferi. So this is an overview of that disease. It's transmitted by the black-legged tick and also by the western black-legged tick, and caused again by Borrelia burgdorferi. So early symptoms: flu-like illness, muscle aches and pains, joint pain and or swelling, fatigue, malaise, fever, headache. Possible rash. Now, the bullseye, a lot of literature indicates, is only present maybe 9% of the time. It is a subset of the EM rash, erythema migrans, which 60 to 80% of patients develop, although a lot of indications are that even more patients, even less patients than that may develop a rash for Lyme disease. Testing. Now, there are various tests, including the 2-tier, which is the ELISA, and if negative or equivocal, is followed by the Western blot. There are also other tests now available. Treatment is doxycycline generally, at least for early disease. Now, this is going more in depth into symptoms: musculoskeletal, joint pain or swelling or stiffness, muscle pain, migrating muscle pain or cramps, shin splints, neck or back stiffness, joint pain and or swelling or cramps that may migrate, TMJ, neck creaks and cracks, tender soles of your feet. Reproductive, testicular pain, pelvic pain, menstrual irregularity, unexplained milk production, sexual dysfunction or loss of libido. Cardiac or pulmonary, chest pain or rib soreness, shortness of breath, heart palpitations, pulse skips, heart block, heart murmur, valve prolapse. And patients can die from heart complications of Lyme disease and have. Neurological, muscle twitching, headache, tingling, numbness, burning or stabbing sensations, facial paralysis, dizziness, poor balance, increased motion sickness, lightheadedness, wooziness, difficulty walking, tremor, or confusion. Difficulty thinking, concentrating, reading, forgetfulness, poor short-term memory, disorientation. Now, in respect to that, I have known a lot of individuals, including many professionals over time, who, when they develop that particular aspect, have gone to work and come out and don't remember at all where they parked. And this is a place they've parked every day going to their employment, or they forget what car they have come in, or they don't remember how to get home. Difficulty with speech, double or blurry vision, eye pain, blindness, increased floaters, increased sensitivity to light or sound or smell, buzzing or ringing in ears, ear pain, decreased hearing or deafness, seizure activity, white matter lesions, low blood pressure. Neuropsychiatric. Now, a lot of people do not realize that Lyme can indeed cause neuropsychiatric manifestations. Mood swings, irritability, depression, disturbed sleep, personality changes, OCD, violent outbursts, anorexia, paranoia, panic anxiety attacks, hallucinations. Gastrointestinal, nausea or vomiting, loss of appetite, GERD, change in bowel function, gastritis, abnormal cramping, cystitis, irritable bladder or bowel dysfunction, newly diagnosed irritable bowel syndrome. Other, fever, sweats or chills, weight change, fatigue, tiredness, hair loss, swollen glands, sore throat, difficulty swallowing, swelling around the eyes, and swelling of feet. And I just want to mention, in regard to the seizures that I mentioned in there, when my youngest daughter had her very serious Lyme early on, she was out of school 4 full years and 2 partial years. And for 3 years, she was in temporal lobe seizures, pretty much 6 out of 7 days a week. It was pretty horrifying. Now I'm going to speak about the Lyme disease you may not know, because this comes from Borrelia mayonii, which is a relatively newly discovered organism, but it is producing disease right now in the Midwest. It's transmitted by black-legged tick. Symptoms, early symptoms, fever, headaches, rash, neck pain, later stages, arthritis. Now, some of the differences from Borrelia burgdorferi Lyme may include more nausea and vomiting, more diffuse rashes, and higher concentrations of bacteria in the blood, 180-fold higher than Borrelia burgdorferi sometimes. Now, you may know that in Borrelia burgdorferi, it does not remain in the blood for long periods of time. And even when it's there, it's usually not in very high concentrations. So this is a major difference. So Meionii is already found in animals in the upper Midwest, the white-footed mouse, American red squirrel in Minnesota, in Wisconsin, eastern chipmunks, and that has very high infection prevalence. So they think maybe this species may become a very important reservoir in the upper Midwest for this disease. Is there testing? Well, generally not specifically for this. The treatment is generally the same treatment as for Lyme, doxycycline, and usually docs make a clinical diagnosis, though some of them may use that other tests just to see. Co-infections, one tick bite can cause more than one disease. So deer ticks, for example, can carry and transmit Borrelia burgdorferi or Meionii, Babesia, Anaplasma, Ehrlichia, Bartonella, Miyamotoi, Powassan virus, tick paralysis toxin. And we have to remember that other tick-borne diseases may have similar symptoms as Lyme, but they might have totally different treatments. So it's very difficult sometimes to diagnose. Now, Anaplasma. Anaplasma phagocytophilin bacteria is transmitted by the scapularis and the pacificus ticks, and the symptoms onset generally begins within a week of a tick bite. Early signs: fever, severe headaches, malaise, muscle pains, chills, nausea, and vomiting. If treatment is delayed or other medical conditions present, it can cause a very severe illness. And age, increase in age, is also a risk factor. Signs and symptoms of severe late stage, respiratory, bleeding, organ failure, and death can occur. Now, there are tests, blood smears, IFA, PCR, and treatment is generally doxycycline. In rare cases, it can be spread through blood transfusion. Now, Lichiosis, this is caused by two different ticks. The Ehrlichia chaffiensis is caused by the Lone Star tick, as is Ehrlichia owengii. Now, Ehrlichia murus euclarensis is transmitted by the black-legged tick. Now, there are tests, there's blood smears, PCRs, symptoms and treatment: fever, chills, headache, muscle ache, and sometimes upset stomach. And doxycycline can be used for all ages. Ehrlichia is sometimes spread through the blood transfusion and organ transplants in rare cases. Now, babesiosis. This is one of the most common co-infections with Lyme. It's a parasite. It can be transmitted and is often transmitted through the blood supply. So in 2018 and 2019, the FDA finally approved tests to screen most of the major species of Babesia. Now, Babesia microti is the main species in the US to cause infection, and that's transmitted by the deer tick. Now, there are rare cases also of congenital transmission. I had a friend of mine who was studying to be an MD, and she had Lyme and Babesia. She had her Lyme treated during pregnancy, had no idea that Babesia could be congenital, and almost lost her baby. Now, there's testing, microscopic diagnosis, blood smear, IFA, PCR. Now, this can be fatal to the elderly or those with no spleen. Now, Lyme, if you have a Lyme co-infection, then this can have more serious symptoms. And there were more than 14,000 reported cases in the US between 2011 and 2019. Now, what are the symptoms? Fever, chills, fatigue, headache, muscle pain, sweats, and anemia. And symptoms on routine lab work hemolytic anemia, thrombocytopenia, proteinuria, hemoglobinuria, elevated liver enzymes, BUN, creatinine. Treatment can be atovaquone and azithromycin, clindamycin, and quinine, or other doctors use other treatments. And this was this little map will show you, this was early map showing the cases only up till 2013, but you certainly had Babesia cases. Borrelia miyamotoi disease. This is caused by a spirochete-shaped bacteria closely related to relapsing fever group of Borrelia. It's more distantly related to Borrelia burgdorferi that causes Lyme disease. It's transmitted by Western black-legged and the black-legged ticks. So what are the symptoms? Fever, headaches, and chills are most common. Body and joint pain, fatigue, and rash are uncommon. And it has recurring febrile episodes that last approximately 3 days. And they're separated by afebrile periods of approximately 7 days. That, of course, is the recurring fever aspect. Testing can be microscopy, serology, PCR testing, and of note is that you may have a false Lyme positive test due to the similarity of the proteins between these two diseases. Treatment is doxycycline, can also be Zithro or ceftriaxone, and it's also susceptible to penicillin and other drugs. Bourbon virus. This is caused by the bite of ticks primarily found in the eastern half of the U.S., the black-legged tick, of course, which you have, and the groundhog tick and the squirrel tick, and they apparently rarely bite humans. And this is also rarely transmitted through blood transfusions. Now, the time of transmission of this virus from the tick into people can be as soon as 15 minutes after attachment. That's why I mentioned early on, the quicker you get that tick off, the less chance you have for disease. Now, the symptoms, the incubation period is 1 to 4 weeks after the bite. The initial symptoms, headache, fever, nausea, vomiting, and generalized weakness. And it can progress to encephalitis and meningoencephalitis or aseptic meningitis. The symptoms of encephalitis may include altered mental status, seizures, speech problems, paresis or paralysis, movement disorders, and cranial nerve palsies. And encephalitis and meningitis, the important thing to remember here is that 10% of Powassan neuroinvasive disease cases are fatal. And 50% of the survivors have long-lasting neurologic deficits, headaches, muscle weakness, focal paralysis, and cognitive. Now, the treatment is a supportive treatment only, and severe disease is often hospitalized. The testing can be serum or CFS, ELISA, and there are special tests that can only be done at the CDC. So if someone has this, it's probably a good idea to get those done and quickly. Now, this disease is nationally notifiable, and the CDC recommends all health departments use national surveillance case definition for this disease. And this is a map just from 2011 to 2020 showing only the neuroinvasive disease cases reported by state of residence. Now, Bartonellosis. Bartonella species is transmitted by fleas, lice, cat scratches, and bites. It can be carried by Ixodes scapularis, the black-legged or deer tick. The CDC still questions whether or not there is transmission by ticks. In a 2004 study in the state of New Jersey, Bartonella was shown to be in deer ticks in the rate of 34.5%. Now, symptoms. When present in combination with Lyme, atypical presentations may result, including visual problems, headaches, significant lymph node enlargement, resistant neurologic deficits, and new onset seizure disorder. Tests. There are diagnostics including acute and convalescent antibody titers, IFA, and or PCR. Treatments, ceftriaxone sodium and ceftriaxone sodium, doxycythro, and some of the treatments being used. And also the Western black-legged ticks have been shown to harbor Bartonella. And actually we have a study that we're funding right now looking to see about Bartonella transmission from ticks. Now, star eye, southern tick-associated rash illness. This is transmitted by the bite of the lone star tick. Again, you have the lone star there. It's also been known as master's disease. Infectious causes unknown. They formerly thought Borrelia lone star eye was the cause. Then they decided it wasn't. It looks and acts like Lyme disease. You can get an EM rash. You may get fatigue, headache, fever, muscle and joint pains. There is no test for this specific strain or whatever it is. And it's diagnosed by symptoms, geography, and tick bite. And here's what CDC says on treatment. In cases of star eye studied to date, the rash and accompanying symptoms have resolved following treatment with an oral antibiotic, but it's unknown whether this medication speeds recovery. Because star eye resembles early Lyme disease, physicians will often treat patients with oral antibiotics. Now, Q fever. This is caused by Coxiella burnetii bacteria. It's transmitted most often by inhaling bacteria containing dust or eating or drinking contaminated foods. And cattle, sheep, and goats are often the reservoirs. Other forms of transmission are rare, but include tick bites and human-to-human transmission. And I've placed 3 citations there. There are many more. At this point, CDC does not indicate it's a tick-borne disease on its tick-borne disease website. However, the CDC does on its public health imaging website put the picture, which you see up there of the tick, that's the Dermacentor marginatus, the sheep tick, as a known vector of Q fever. So I guess CDC wants to have it both ways, just in case. Now the symptoms: high fevers, severe headache, malaise, myalgia, chills and/or sweats, cough, nausea, vomiting, diarrhea, abdominal pain, and chest pain. It may include endocarditis, encephalitis, pneumonia, hepatitis, and splenomegaly. The tests: IFA titers. The treatment: you need to remember first that 50% of cases required hospitalization from 2002 to 2014. Doxycycline or hydrochloroquine are some of the treatments. In chronic Q fever, there's multiple drugs. The case numbers in 2019, 178 acute, 34 chronic, and the disease has been on the rise. You should also know it's been previously weaponized for use in biological warfare and is considered a potential bioterrorism threat. And you could find that, I think, on the CDC website. Rocky Mountain spotted fever. This is transmitted by the American dog tick, the wood tick, and the brown dog ticks. Now, there are increased new cases in the Southwest from the brown dog tick, which I mentioned before. Now, the lone star tick can carry, but transmission is unsettled at this point. CDC doesn't say the lone star tick it transmits it. However, published in Emerging Infectious Disease, their journal, the lone star tick transmission by a lone star tick in South Carolina is presented. So the jury, I think, is out yet. This is caused by Rickettsia rickettsii bacteria. Symptoms include fever, headache, myalgia, and characteristic rash on wrists, ankles, soles, and palms. And rash may be absent in early disease. Now, the treatment is doxycycline. And the CDC says 5 to 10% mortality in clinical reviews. Now, in Lancet in 2007, they indicated in a publication 20% mortality. Now, the Hhs Tick-Borne Diseases Working Group report to Congress in 2020, of which I was a public member. Their recommendation was to improve provider recognition and empiric treatment of Rocky Mountain at early stages of illness using doxycycline, including in children younger than 8. And the big concern was that it takes a long time for these tests to get the results, and the disease progresses quickly and it can kill you, and that a lot of docs were not treating with doxycycline younger than 8. Tick-borne relapsing fever, 1990 through 2011. You can see the map, and it's transmitted by orthonodoros ticks, which are soft-body ticks, and I'll talk a little bit about that. Pacific Coast fever, that's transmitted by Pacific Coast tick, Rickettsia species 364D, and the treatment, doxycycline, and that's for most all of the spotted fever infections. And spotted fevers can range from mild to life-threatening. And this provider may order certain blood tests, but it can take weeks for them to develop, and the provider should recommend antibiotic treatment before results available if he thinks that it's spotted fever. And that's what I was mentioning about the recommendations in the reports and what CDC is saying, basically. Heartland virus transmitted by bite of infected tick, thought to be the Lone Star tick. And you can see the states where heartland has already been found in the South and in the Midwest. And symptoms are fever, fatigue, loss of appetite, headache, nausea, diarrhea, muscle or joint pain, and many people are hospitalized. And this is the one where testing can only be performed at the CDC, and healthcare providers should contact the state health department. And treatment, supportive care only, and some deaths have resulted. Now, the Bourbon virus transmitted by tick thought to be the Lone Star. The symptoms: fever, tiredness, rash, headache, other body aches, nausea, vomiting. Low blood counts for cells that fight infection and help prevent bleeding. So testing and treatment, blood tests are available, but there's only symptomatic treatment. Now, you probably heard about the Lyme disease controversy. Well, what is that? What does that mean? So the controversy, simplified, is over whether after treatment, Lyme patients who continue to have symptoms do have an active infection. Or is it all autoimmune, or is it a combination of both? So some of the descriptors that I've seen that have been used for patients that might go into this criteria: chronic Lyme disease, persistent Lyme, post-Lyme syndrome, post-Lyme disease syndrome, post-treatment Lyme disease, post-treatment Lyme syndrome, post-treatment Lyme disease syndrome, ad infinitum. And there are many, many, many. Now, this chart comes out of the Hhs Tick-Borne Disease Working Group report to Congress 2020. And what it shows is the IDSA, the Infectious Disease Society of America, versus ILADS, International Lyme and Associated Diseases Society, treatment guidelines. There are two different guidelines for treating Lyme disease. And one, the IDSA, they generally do not believe that there's such thing as persistent infection. So their treatments are generally all short-term treatments. They don't approve of treatments for long-term. Now, the ILADS guidelines, on the other hand, those are a lot of the treating physicians across the country that are treating patients who have more prolonged symptoms from Lyme disease, and they do a clinical diagnosis and use testing as an adjunct to that, and they feel that there are cases where longer-term treatments may be appropriate. And they also feel that persisting infection may be present along with autoimmune and symptoms. So my Lyme data patient registry, and this again was noted in the working group report to Congress. It, like other registries, provides crucial information about patients with persistent symptoms associated with Lyme disease and their clinical experiences, including their experiences accessing care and treatment and the obstacles they frequently face in obtaining appropriate care. So over 12,000 patients were enrolled in the patient registry at that time. Less than 4 months took 16% to be diagnosed, 12% 5 to 11 months, 17% 1 to 2 years, 20% 2 to 6 years, 36% 6 years. So in summary, 84% were not diagnosed within the first 4 months, and 72% saw 4 or more docs before diagnosis. And these factors often lead to somebody having chronic illness, long-term symptoms. 72% were misdiagnosed as psychiatric, FM, CFS, thyroid, RA, MS, lupus, learning disabilities, Parkinson's, ALS, etc. So cases of post-treatment Lyme disease, studies have shown that Lyme treatment failure rate may range from 10 to 20%. This is after treatment. Now, this study I cited is out of the NIH from Dr. Adriana Marquez, and there are many other studies that show that. Now, there are some studies that indicate that more Lyme patients fail treatment than 10 to 20%. And this one shows up to 35%. And that was from out of Johns Hopkins, and it also was in the HHS report to Congress. Now, Lyme and its sequelae are responsible for significant numbers of school and work absences and are estimated to cost more than $1 billion per year for healthcare in the US. One estimate of costs shows direct Lyme medical costs could represent $1.3 billion each year, with marked increases when therapy fails to return patients to their pre-Lyme disease health status. Now, is there research to support persistence or chronic Lyme? Well, here's some of the research out there. This first research, these are called persisters, and a lot of research was done by Hopkins and also Northeastern University, and now many others. This is relatively recent research. So what are persisters? They're bacterial cells that can escape effects of antibiotics without genetically changing. And these cells go dormant when treated with antibiotics, yet can grow again after treatment. Unlike resistant cells, which grow in the presence of antibiotics, persisters don't grow in the presence of antibiotics, so the disease can flare up again when treatment stops. There's also biofilm studies. Biofilms are colonies of bacteria encased in slime that act as one and are highly resistant to antibiotics and host defenses. And there's research undergoing in the University of New Haven and a number of other institutions. And these are 4 significant animal studies from different institutions, different animals, which show that after treatment with antibiotics, that the spirochete was able to be found. Now, there's a xenodiagnostic study from the NIH, again, Dr. Marquez, And actually, laboratory reared larval deer ticks were placed on 36 subjects and allowed to feed to repletion. Ticks were then tested for Borrelia burgdorferi. So what did they found? They actually found 2 cases that were positive for Borrelia burgdorferi DNA in the patient with erythema migrans early during therapy and in a patient with post-treatment Lyme disease syndrome. But there's insufficient evidence to conclude that viable spirochetes were present in each patient. So in other words, a lot more research needs to be done. So what are some of the reasons that patients have difficulty getting diagnosed and treating? Well, for a long time, and I hope it's going to change, there's a new case definition this year, we'll see, misusing the CDC surveillance criteria case definition for Lyme. And what the CDC said on their statement on surveillance case definitions, they are used to establish uniform criteria for disease reporting and should not be used as the criteria for establishing a clinical diagnosis, determining the standard of care for a patient, setting guidelines for quality assurance, or providing standards for reimbursement. But what has been happening in practice, doctors are inappropriately requiring CDC surveillance criteria to diagnose. They're using it to determine the standard of care, and insurance companies are using criteria for reimbursement. Up until 2022, those guidelines that were used were CDC's 2017 version. They're now using the 2022 Lyme disease, which is the next iteration after 2017, and it will be used for all cases in 2020. So on this new definition, it says this CSTE case definition is intended solely for public health surveillance purposes and does not recommend diagnostic criteria for clinical partners to utilize in diagnosing patients with potential Lyme disease. And also, these new guidelines have much more choices of what kind of confirmatory lab evidence can be used to diagnose patients. So time is going to determine if these changes will help Lyme patients in the area of Lyme disease diagnosis and treatment. So what's differential diagnosis for Lyme? Well, Lyme can mimic many other diseases and conditions: MS, ALS, CFS, FM, rheumatoid, Alzheimer's, Parkinson's, lupus, autism, ADD, ADHD, psychiatric conditions. So the doctors need to see if Lyme is causing these symptoms clusters and treat for Lyme if it is the underlying infection. So what about a Lyme vaccine? Well, there are current Lyme vaccine trials, or I should say there is one, Valneva, Pfizer, and their first phase 1 was in 2016. And also they were fast-tracked by the FDA in 2017. In 2020, Valneva then formed together with Pfizer, and Pfizer put in a lot of money. And in 2022, according to Pfizer's phase 2 trial, they showed that a third vaccine dose would have value. So now in 2022, as of August 8th, Valneva and Pfizer have a stage 3 study, and enrollees are 5+ years, and they're going to have 6,000 participants in Europe and the US. Now, the concerns many of us have about this are we have no knowledge that the issues brought forth from the last vaccine were discussed or addressed. And we haven't seen evidence of public discussion that there were even issues and how they were addressed. And the manufacturer has not reached out to stakeholders such as the Lyme community or to physicians who were involved during the first vaccine for input to our knowledge. Now, I should state I should go back here, that what happened with the first vaccine, which was the Limericks vaccine at the turn of the century, it worked by injecting people with OspA, the outer surface protein of the Borrelia bacteria. And it taught the body's immune system to recognize the bacteria and launch attack if it showed up after the bite. but the Limericks vaccine was withdrawn and the manufacturer cited poor sales, but there was serious controversy surrounding the arthritic and neurologic issues that some vaccine recipients said they had. And there was a class action lawsuit which also ensued. And our organization had heard for so many patients during that time. We weren't involved in this at first, but we had to become involved in what was happening with patients. And I went and testified down before the FDA on some of it because of the fact that so many patients, that's all they wanted to talk about when I went to meetings. And so anyway, the bottom line is, so we still, many of us still have concerns, and we would like to see those publicly addressed. So what about legislation? We've worked for two or more decades with Congress, in particular with Congressman Chris Smith, who's the co-chair of the Lyme caucus. And we had this year him introduce a bill in May, which would amend the Individuals with Disabilities Education Act to more clearly show that Lyme causes disabilities that affect education of children and enhance educational services related for children in Lyme. And myself and many of us in the LDA and other organizations have had involvement. I was a 12-year Board of Education member and had to learn a lot about Lyme in our schools. That's how I got actually started. Now, the Hhs Working Group, I did talk about it, and basically it was created by legislation that we in the Lyme community helped to write. I personally helped to write that, and also was instrumental in getting it passed and doing the final workings of the bill. And what this did, it provided a working group where every stakeholder pretty much would have seat at the table to decide what was happening with tick-borne diseases. So patients have a seat at the table, treating physicians from both perspectives of Lyme, whether they believe in persistent, they don't believe in persistent, and of course, federal members. And we produced a report to Congress. I was on the group that reported in 2018 and also in 2020. And Limericks is a function of Health and Human Services coming together with the largest public-private partnership in the world, forming with the Stephen and Alexandra Cohen Foundation. And they allow prize competitions and so on, and doing it especially for testing and other kinds of research. So the bottom line here, folks, and we're almost done, can we escape the ticks? Well, basically, scientists have discovered down the bottom of the world, if you will, when you see that globe, that globally distributed seabirds, their ticks contain 4 new arboviruses that are infesting colonies of king, royal, and rockhopper penguins in the sub-Antarctic Macquarie Islands, and most importantly to us, in sub-Antarctic Southern Hemisphere, just north of the Arctic Circle, the Campbell Islands and Isle Crozet. That Lyme disease that caused by the spirochete Borrelia burgdorferi is carried by seabirds, transmitted by Ixodes tick, and it's been found through DNA analysis in ticks on these islands in the king penguins. They've found antibodies to Borrelia burgdorferi. And this is a tick that was found in the Dominican Republic, encased in amber, and it's 15 to 45 million years old. And when they removed it out of the amber, they tested, and they found a pyroplasm which resembles Babesiidae family, which is basically Babesia. Now, this is a snake in Australia that jumped into a swimming pool to get rid of its ticks, and the woman had to call the Gulf Coast and Brisbane snake catchers. They came and got the snake, and found 500 ticks on this snake. Now, most people don't even know that reptiles can indeed harbor ticks. So in prevention, this is a tick bird on top of a rhinoceros. They actually exist and they peck off the ticks. What do we have? Well, in our country, we have cowboys out of the USDA that actually patrol the southern border, and they look for livestock which they capture, and they're treated. And all cattle are inspected and run through spray boxes or submerged in dipping vats charged with this co-row. And the reason is because for many, many decades in our country, our cattle were getting sick and dying from a tick-borne disease that was being brought in from ticks across the border. So who protects us? Well, basically we protect ourselves: pants and socks, long sleeve shirts, light colored clothing, hats, tuck in long hair, full body tick checks, most important, remove ticks properly and promptly. And outside, you can put your clothes in the dryer for 30-35 minutes. And there are special clothes, rhino skin or chemical free clothes. You wear them under your clothing, and they're very tight weave, like long underwear, insect shield or repellent apparel, and you can either buy their clothing or you can ship your clothing to them and they'll treat it. And they're the first ever EPA registered insect repellent clothing. They're permethrin treated. And there are sprays for clothes and skin, and always read the manufacturer's directions. Be especially careful if considering for children. And there are natural products out there and some being considered. The LDA doesn't make product recommendations. This is a new thing they're looking at: balsam fir, essential oil, as a possible natural product. And this is my favorite picture I share with you of entopathogenic fungus for tick control. This can be used out on your property. And in closing, I love opossums. I never did until I found out that Rick Osfeld from the Carey Institute said that opossums can kill about 5,000 ticks a season, and more than 90% of the ticks picked up by it are swallowed and killed. So I thank you very much. And I thank everyone who paid attention through this, sat through it, and maybe we'll look at it again and ask questions. And remember, I am not a physician. Thank you very much.
Thank you very much, Pat. This was just an amazing presentation. We will look now. Lottie, are you able to see if there's questions or not?
I don't see any questions or anything in the chat.
Okay. All right.
Wait a minute. Molly Herman has a question. I'm going to unmute her. Go ahead, Molly.
Hi, everyone. Hey, Pat, thank you so much. This was super informational. I'm an epidemiologist at the Northeast Nebraska Public Health Department. We work with Winnebago Public Health on any number of things. And I was wondering if Jane or Mona, if you'd had a chance to talk with Pat about the Thurston County Lyme cluster of last year and the subsequent environmental investigation that we did.
I have not personally.
So just in case you're interested, Pat, we had a couple of Lyme cases, and throughout the course of our epidemiological investigation determined that, gosh, they had to have picked it up in Thurston County. That's where they were at during the look back period. And so we went out with a couple of the state vector-borne crew, and we found that Thurston County has an established black-legged tick population. And I think I want to say about between 58 and 70% of the ticks then subsequently, they found Borrelia burgdorferi in those ticks. So it is in Northeast Nebraska, which makes sense because, I noticed it was up in the southwestern counties of South Dakota, so kind of along the Missouri River Valley. So we're trying to make sure our providers are aware to ask about tick exposure and patient history.
That is great. I'm always delighted to hear that you're taking the initiative in doing that. I think your state has actually done some pretty good things from what I can see.
Thanks.
And
Yeah, we've got a great vector-borne epi. He was on for the first hour of the presentation, but I think he had to jump off.
sure, I understand. You know, it's you have to look at what material needs to be presented, and you know, and I figure that people can always go back, you know, when it's online and review the material for themselves if they have questions. I'm always happy either to answer them. If I don't have the answers, I'm happy to get the answers from other individuals, you know, because I do know a lot of the people that work in the fields all over. So I'm always happy to do that.
Yeah, thank you so much. I already have a couple of rabbit holes that I think I'm going to go down from the stuff you presented today. So I'll reach out if I have some questions.
Good.
Thank you.
Yeah, that's absolutely great, Molly. Thank you so much. Thank you, Pat, again for the presentation. We'll open. Are there any other questions that we can share, or you can present to Pat? She's a wealth of knowledge, as I'm sure you've identified from her presentation. If not, then I think we'll call it, we'll bring this to a close. Again, my heartfelt thanks to Pat for an absolutely stimulating presentation. All those that attended, again, also thanks to the National Indian Health Board that provided funding for this webinar. We will be continuing with some additional infectious disease webinars, which I will continue to send out the invitations as we have them scheduled. And so good day to everyone. Have a great rest of Friday and a great weekend. Thank you so much.
Thank you.